We will discuss personality disorders. In this unit, we will discuss a number of mental health disorders, their pathophysiology, etiology, signs and symptoms, risks, possible complications, treatments, nursing care, and various theories. The specific disorders addressed in this presentation include the following: personality disorders, including borderline personality disorder and antisocial personality disorder. Personality disorders involve long-standing patterns of behavior, emotions, and thinking that are deeply ingrained in the individual. These patterns are not temporary reactions to stress. Instead, they are inflexible and consistent across many different situations. People with personality disorders usually develop these traits early in life, often becoming noticeable by adolescence or early adulthood. A key point to remember is that these traits cause significant impairment in the person's daily functioning, their relationships, or their emotional well-being. They may also cause distress for the people around them, even when the individual themselves does not feel that anything is wrong. Personality traits involved in these disorders are inflexible, meaning the person has difficulty adjusting their behavior in response to different social situations. These traits are also enduring, which means they persist over time and are not related to temporary stress or mood episodes. In addition, the traits are pervasive, meaning they occur across multiple areas of life, for example, at home, at work, and in relationships, not just in one isolated environment. Finally, these patterns are maladaptive, meaning they interfere with healthy functioning and coping skills. This can show up as unstable relationships, poor emotional control, impulsive decisions, distorted thinking, or rigid perfectionism, depending on the type of personality disorder. It is important to understand that people with personality disorders often struggle in interpersonal settings. They may have difficulty trusting others, regulating their emotions, or understanding social norms. Many do not seek treatment on their own because they may not view their behavior as problematic. Our role involves using therapeutic communication, maintaining clear boundaries, and supporting patients while also promoting safety. Understanding that these behaviors stem from long-standing patterns, not intentional misbehavior, helps us maintain a compassionate and professional approach. When considering the etiology of personality disorders, it is important to emphasize that there is no single known cause. Instead, personality disorders are believed to develop from a combination of genetic, biological, psychological, and environmental influences that interact over time. This means that personality disorders are not caused by one specific event or single factor, but rather by a complex layering of risks that begin early in life and continue to shape behavior and emotional patterns as the person grows. Genetic factors play a significant role, and research shows that personality disorders tend to run in families. This does not mean a person is guaranteed to develop a personality disorder, but it does suggest a higher vulnerability, especially when combined with stressful or unstable environments. Family environmental factors also contribute, particularly when a person is raised in a setting with inconsistent parenting, trauma, abuse, neglect, or dysfunctional relationship patterns. These early experiences can shape how a person copes, forms attachments, and regulates emotions later in life. Neurobiological and neurotransmitter factors are also believed to contribute. Studies have identified differences in brain structure and function, particularly in areas responsible for impulse control, emotional regulation, and interpersonal processing. Neurotransmitters such as serotonin, dopamine, and norepinephrine may be imbalanced in certain personality disorders, affecting mood stability and behavior. Finally, social factors, including chronic stress, unstable relationships, and early loss, can amplify the risk. Overall, personality disorders arise from the interaction of these influences rather than from a single identifiable cause, which is why early intervention, supportive environments, and consistent therapeutic relationships are so important. Diagnosis of personality disorders is not based on temporary behaviors or mood changes. Personality disorders are diagnosed when a person's long-standing patterns of thinking, feeling, and behaving are rigid, persistent, and significantly interfere with daily functioning or relationships. These patterns usually begin in adolescence or early adulthood and remain stable over time. Because they are deeply ingrained, individuals often do not recognize their behaviors as problematic, which can make diagnosis and treatment more challenging. Personality disorders affect multiple areas of functioning. Behaviorally, individuals may struggle with impulse control, decision-making, or following rules and expectations. Emotionally, they may have difficulty regulating intense or unstable emotions that do not fit the situation. Cognitively, they may misunderstand themselves or others, leading to distortions in how they interpret events. Socially, their behaviors may create frequent conflict, unstable relationships, or problems navigating boundaries. Additional features commonly seen include manipulation, impulsivity, and patterns such as narcissistic tendencies or acting without considering consequences. These traits are not occasional behaviors. They are chronic, inflexible patterns that cause distress or impair functioning. The Diagnostic and Statistical Manual of Mental Disorders, 5th edition or DSM-5, organizes personality disorders into 3 clusters based on shared characteristics. Cluster A includes the odd or eccentric disorders, where individuals may appear socially withdrawn, suspicious, or unusual in their thinking. Cluster B includes dramatic, emotional, or erratic behaviors such as attention-seeking, impulsivity, or disregard for others. Cluster C includes anxious or fearful behaviors, often involving avoidance, dependence, or excessive need for control. Understanding the clusters helps nurses anticipate behavior patterns and apply the most appropriate therapeutic strategies. In this lesson, you will begin focusing on Cluster B disorders, which include borderline personality disorder and antisocial personality disorder, both of which strongly impact safety, emotional regulation, interpersonal functioning, and risk behaviors. Borderline personality disorder is a disorder of emotional regulation, interpersonal instability, and chronic difficulty with impulse control. People with borderline personality disorder often experience intense and rapidly shifting emotions that feel overwhelming and difficult to manage. These emotional swings may not match the situation, and the person may feel unable to calm themselves once they become upset. A key feature of borderline personality disorder is unstable relationships. Instead of seeing people realistically, individuals with borderline personality disorder may alternate between idealizing someone and suddenly viewing them as hurtful or disappointing. This pattern is called splitting, and it creates frequent conflict, emotional exhaustion, and misunderstandings in relationships. Fear of abandonment is one of the most painful symptoms of borderline personality disorder. Even minor changes, such as a late text message or a partner needing personal space, may be perceived as rejection. This fear can trigger intense anxiety, anger, or desperate efforts to keep someone from leaving. At the same time, many individuals experience chronic emptiness, which can feel like a persistent sense of loneliness or lack of identity. Impulsivity is another hallmark of borderline personality disorder and may include reckless spending, unsafe sexual behavior, substance misuse, or self-harm. These actions often occur when emotions become overwhelming and the person seeks immediate relief. Some individuals with borderline personality disorder may also experience transient paranoia or dissociation, especially during times of stress. This can make them feel disconnected from themselves, detached from reality, or suspicious of others. Self-injurious behavior and recurrent suicidal gestures are also common, not always with the intent to die, but often as a way to regulate overwhelming emotional pain. As nurses, it is essential to maintain a calm, consistent, and non-judgmental approach when working with individuals who have borderline personality disorder. We focus on safety, emotional support, clear boundaries, and teaching skills that help improve distress tolerance and emotional regulation. Antisocial personality disorder is defined by a long-term pattern of violating the rights of others and consistently breaking social rules or laws. Antisocial personality disorder does not refer to someone who is simply antisocial or introverted. Instead, it reflects a pattern of behavior that begins in childhood or early adolescence and continues into adulthood. Many individuals with antisocial personality disorder have a history of conduct disorder before age 15, including behaviors like aggression toward people or animals, property destruction, deceitfulness, rule-breaking, or theft. A key feature of antisocial personality disorder is a lack of empathy or remorse. Individuals may harm others emotionally, financially, or physically without feeling guilt, or they may rationalize their actions as justified. This lack of emotional response can make their interactions seem cold, manipulative, or uncaring. These individuals often act impulsively, meaning they do things without thinking about the consequences. This impulsivity, combined with irritability and aggression, can lead to unsafe or risky behaviors, including fights, reckless driving, substance misuse, or criminal activity. Another important characteristic is persistent deceitfulness. People with antisocial personality disorder may lie, manipulate, use aliases, or con others for personal gain, or simply out of habit. They may appear charming at first, which can make manipulation more effective. Irresponsibility is also common. This includes failing to maintain employment, not paying bills, disregarding obligations, or repeatedly violating social norms. Many individuals with antisocial personality disorder struggle with long-term relationships because of these behaviors, and they may shift blame onto others instead of owning their actions. For nursing practice, safety is the top priority. Individuals with antisocial personality disorder may test boundaries, manipulate staff, or display aggression. Clear, consistent limits are essential. It is also important to remain objective, avoid power struggles, and focus on behavior rather than emotion or intent. These patients may not respond to emotional support the way others do, so the nurse's role includes promoting accountability, encouraging treatment for substance use if present, and supporting the patient in developing more responsible, less impulsive decision-making skills. Psychotherapy is the main and most effective approach to treatment of personality disorders. Unlike many other mental health conditions, personality disorders are rooted in long-standing patterns of thinking and behaving, so medications alone cannot correct these patterns. Psychotherapy helps patients understand their condition, identify unhealthy thoughts and behaviors, and replace them with healthier, more effective coping strategies. Cognitive behavioral therapy, or CBT, focuses on helping patients become aware of distorted or unhelpful thinking. By recognizing and challenging these patterns, patients can begin shifting toward healthier thoughts and behaviors. Dialectical behavior therapy, or DBT, is a specialized form of cognitive behavior therapy that is especially effective for disorders involving emotional instability, impulsivity, and self-harm, such as borderline personality disorder. Dialectical behavior therapy teaches skills such as distress tolerance, emotional regulation, mindfulness, and interpersonal effectiveness, skills that help patients build more stable relationships and reduce crisis behaviors. Psychodynamic psychotherapy takes a different approach by exploring unconscious thoughts, early life experiences, and internal conflicts that may be shaping the patient's current behavior. This approach can help patients gain insight into long-standing patterns they may not be aware of. Psychoeducation is another essential component of treatment. It involves educating both the patient and their family about the nature of the disorder, expected symptoms, triggers, treatment options, and coping strategies. Providing this education can improve engagement in therapy, reduce stigma, and strengthen the patient support system. Although there is no medication that cures personality disorders, medications can help manage specific symptoms that may interfere with functioning or therapy. Antidepressants may help improve mood, reduce impulsivity, or decrease anxiety. Mood stabilizers can be helpful when irritability, aggression, or emotional swings interfere with daily life. Anti-anxiety medications may provide relief during periods of heightened agitation, but they must be used cautiously due to the risk of dependence, especially in people who struggle with impulsive or addictive behaviors. Antipsychotic medications may be appropriate when a patient experiences paranoia, severe impulsivity, anger dysregulation, or transient psychotic symptoms. The nurse's role includes observing patient behavior, reporting changes, reinforcing coping skills taught in therapy, and supporting adherence to treatment plans. Overall, therapy, supportive communication, consistent boundaries, and symptom-targeted medications work together to help patients develop healthier relationships and functioning. When caring for patients with personality disorders, nursing interventions focus on safety, clear communication, boundary setting, and consistent structure. These patients often experience intense emotions, impulsivity, or difficulty regulating their behavior, which can place them or others at risk. One of the nurse's most important responsibilities is to monitor the patient's behavior closely. This means observing for sudden changes in mood, escalating agitation, signs of manipulation, or behaviors that suggest increasing impulsivity or loss of control. Early identification of concerning behaviors allows the team to intervene before the situation escalates. It is also important to address and redirect attempts at manipulation in a calm and consistent manner. Many patients with personality disorders, especially borderline and antisocial personality disorders, may use splitting, charm, threats, or guilt to try to influence staff. The goal is not to punish or confront the patient, but to gently reinforce boundaries and maintain consistent expectations. Staying neutral and avoiding power struggles prevents staff from reinforcing maladaptive behaviors. We want to model stable, predictable interactions to reduce anxiety and confusion for the patient. When patients display anger or escalating impulses, encouraging physical outlets such as exercise, walking, or other safe activities can help reduce tension. These interventions channel emotional energy in a healthier way and prevent aggression from being directed towards self or others. Additionally, ensuring environmental safety is essential. Removing potentially dangerous objects such as sharp items, belts, cords, or anything that could be used for self-harm or aggression is part of routine risk reduction. This applies especially to patients with a history of self-injury, suicidal behaviors, or impulsive outbursts. Across all interventions, your presence, a calm tone, predictable behavior, and following facility protocols all contribute to a therapeutic environment. Nurses play an important role in supporting the treatment plan, recognizing triggers early, and helping patients use healthier coping skills. Consistency among the nursing team also prevents mixed messages, which can worsen symptoms in patients who already struggle with trust, emotional stability, and boundary recognition. This concludes the presentation. Thank you.